Retinal detachment is a serious condition that occurs when the retina, the thin layer of tissue at the back of the eye, pulls away from its normal position. This can lead to vision loss if not treated promptly. Managing retinal detachment typically involves surgery to reattach the retina to the back of the eye. Retinal detachment itself is a painless condition, but there are few warning signs which appear before it occurs, like sudden appearance of many floaters. Floaters are tiny specks seen in field of vision, flashes of light in one or both eyes, photopsia, blurred vision, gradually reduced side, peripheral vision, or a curtain-like shadow in front of eye. Three main types of retinal detachment: Rhegmatogenous, tractional, and exudative. Treatment depends on type and extent of detachment. There are several different surgical techniques that can be used to repair a detached retina, including pneumatic retinopexy, scleral buckling, and vitrectomy. The type of surgery that is recommended will depend on the severity and location of the detachment. During the surgery, the ophthalmologist will work to reattach the retina using a variety of techniques, such as injecting a gas bubble or silicone oil into the eye to push the retina back into place, or using a laser to create scar tissue that will hold the retina in place. After the surgery, patients will need to follow a strict regimen of eye drops and medications to prevent infection and promote healing. It is important for patients to follow their doctor's instructions carefully to ensure the best possible outcome. While managing retinal detachment can be a challenging and sometimes frightening experience, with prompt treatment and proper care, many patients are able to regain their vision and avoid permanent vision loss.